This is video podcast 59 from LearningRadiology.com. Video flashcards, most commons in neuroimaging. I'm William Herring from Albert Einstein Medical Center in Philadelphia, and I want to give thanks to Josh Albrechtsen from Bridgeport Hospital in Bridgeport, Connecticut for his help in this podcast. The way these podcasts work is that on one card there is a question like what animal moves at a snail's pace. You pause your computer or MP3 player while you ponder the answer. On the other side of the card is the answer, in this case, a snail. These podcasts are designed to be audio only, video only, or both audio and video podcasts. All of the following refer to the pediatric age group. What is the most common site of intracranial hemorrhage in premature infants? The germinal matrix. What is the most common type of Arnold-Chiari malformation? A Chiari II, which is almost always associated with the myelomeningocele. What is the most common posterior fossa brain tumor in the pediatric age group? A cystic astrocytoma. What is the most common head and neck malignancy in children? A rhabdomyosarcoma. What is the most common suture to contain intersutural bones? The lambdoid suture. What is the most common suture to fuse prematurely? The sagittal suture. What is the most common site of intracranial hamartomas in tuberous sclerosis? The walls of the lateral ventricles. What is the most common perinatal viral infection of the brain? Cytomegalovirus. What is the most common site and side of idiopathic scoliosis? A dextroscoliosis of the thoracic spine. What is the most common congenital CNS infection? Cytomegalovirus. What is the most common brain tumor in infants? Teratomas. What is the most common brain tumor in children? An astrocytoma. What is the most common location of pediatric brain tumors? The posterior fossa. What is the most common congenital cause of hydrocephalus? Aqueductal stenosis or obstruction. What is the most common suprasellar mass in children? A craniopharyngioma. What is the most common pineal tumor? A pineal germinoma. What is the most common intraocular neoplasm in childhood? A retinoblastoma. What is the most common cause of a stroke in a younger patient? An embolism. The following refer to adults. What is the most common primary demyelinating disease? Multiple sclerosis. What is the most common cause of an intracellular mass? Pituitary adenomas. What is the most common location of an arterial dissection? The carotid artery. What is the most common focal central nervous system infection in AIDS? Toxoplasmosis. What is the most common location of a berry aneurysm? The junction of the anterior cerebral artery and the anterior communicating artery. What is the most common cause of subarachnoid hemorrhage? Trauma. What is the most common non-traumatic cause of intracerebral hemorrhage? Hypertension. What is the most common injury site in non-penetrating traumatic brain injury? The inferior surface of the frontal lobes and the anterior temporal lobes. What is the most common location of a hypertensive hemorrhage? The basal ganglia. What is the most common cause of stroke in an older patient? Atherosclerosis. What is the most common type of brain edema? Vasogenic edema. What is the most common adult primary brain tumor? Glioblastoma multiforme. What is the most common lobe for oligodendrogliomas? The frontal lobes. What is the most common enhancing tumor in the middle ear? A glomus tympanicum tumor. What is the most common cause of proptosis in an adult? Thyroid ophthalmopathy. What is the most common benign orbital tumor? A hemangioma. What is the most common cerebellopontine angle tumor? A vestibular schwannoma. What is the most common location of a chordoma? The sacrum. What is the most common cause of basal ganglia calcification? Idiopathic. What is the most common tumor of the foramen of Monro? A subependymal giant cell astrocytoma. What is the most common tumor originating from the clivus? A chordoma. What is the most common brain tumor in an adult? Metastases. What is the most common primary brain tumor in the posterior fossa of an adult? Hemangioblastoma. What is the most common location of metastases? The gray-white matter junction. What is the most common primary site for metastases to the brain? Lung cancer. What is the most common extraaxial tumor in adults? Meningioma. And lastly, what is the most common location affected by carbon monoxide poisoning? The globus pallidus. If you enjoyed this podcast, try podcast 15 for cardiac most commons, podcast 21, chest most commons, podcast 25, GI most commons, podcast 38, musculoskeletal most commons, and podcasts 46 and 47, pediatric most